Hello and welcome to Inside EMA, a podcast about the science behind medicines regulation and the people who make it possible. My name is Alessandro Faia, I'm a communications officer at EMA, and today we will talk about medicines shortages. I have two lovely guests. One is Monica Diaz, Head of Supply and Availability of Medicines at EMA.
Hello.
Welcome, Monica. And my colleague Giulia Gabrielli.
Hello.
Giulia is also a communications officer and she works for the social media team here at the agency. Today we talk about medicines shortages. I think it's something we have all experienced at some point in our lives, either directly or indirectly, or maybe we read about it in the media. What are medicines shortages and why do they occur?
Yeah, so indeed, first of all, I can say that there are different root causes for shortages. And in fact, shortages are multifactorial. So in most instances, it's not one particular reason that resulted in a shortage, but various reasons. So it could be that there is a manufacturing issue. It could be that, for instance, there is a distribution issue. So there are many root causes of shortages, and it tends to be actually several causes, several issues that result in then the patient not having a particular medicine. The other thing I would like to also already perhaps mention to you is the fact that there are different types of shortages. So there will be a shortage where a patient goes to the pharmacy and the medicine they've been prescribed is not available. And the patient will go back the next day or in 2 days' time, and the pharmacy will then have the medicine available to them. Now, there are other situations, and those are the ones that we actually deal with at a European level at EMA, and those we call them critical shortages. And these are situations where actually our colleagues, they're working in the national competent authorities in the member states, have put all the efforts in place to try to prevent these shortages, but they have not, or mitigate them, but they have not been successful. So that there is a need for the member states and the European Medicines Agency to work together in order to address that shortage that in most cases is a critical shortage because there are no alternatives available for patients.
Because it's something that we experience also, in let's say in other areas of our life. So we live in a complicated world. Supply chains can be fragmented, or in any case there's a lot of moving parts and there's a lot of interconnectivity. Correct. Let's say in our world. So it's something that it more or less resembles that what we experience in other areas of our life.
Day-to-day life, yeah. And in terms of causes, you said it's multifactorial. Some of the causes that are happening at national level, I guess, are different than some of the causes that could be happening at European level. Like, what kind of things are we looking into when we're talking about?
So in terms of the root causes of shortages, there is no difference from national level at European level. So as I said, multifactorial, and Alessandro, you're referring to the supply chains, global supply chains, and really the fact that nowadays there are many vulnerabilities in the supply chains that lead to medicine shortages.
By vulnerabilities, we mean that we could rely, for example, there are, factories that can shut down, there are natural disasters.
Exactly. So there are many, let's say, elements that can result in medicine shortages. For instance, hurricane. And we had a case of the Hurricane Ilan in the US that impacted a manufacturing site that was producing IV solutions, and that had an impact on the supply of these medicines for patients in the European Union. So yes, indeed, there could be many factors that result in medicine shortages. And what is important for us is to have early warnings and act very quickly. So as soon as we are aware of a particular event or incident, then we reach out to all the stakeholders in the supply chain to understand what is the situation on the ground, what are the implications in terms of the supply of these medicines, so that we find alternatives or put in place measures to make sure that the patients will not be left without their medicines.
And sorry, when you say supply chain, actors in the supply chain, you're talking about companies, but you're also talking about other countries, right? European country to European country.
as well. So not only within the European Union, but also with our counterparts in other parts of the globe. So supply chains, as I mentioned, they are global, so it's important to have that cooperation with other regulators throughout the world. And we also, in many instances, need to reach out to companies outside the European Union. There was a case with the company in the US that was impacted by that hurricane. So when I talk about supply chain, then I don't talk about only supply chain actors. I don't talk about only the pharmaceutical industry, but also all the other key players in the supply chain. So we're talking about wholesalers, we're talking about parallel distributors, we're talking about healthcare professionals, we're talking about patients as well. So the entire supply chain, we need to interact with all actors so that we can collect the information and make sure that we put the measures in place that will prevent the shortage, if not possible, to mitigate the impact on patients.
I mean, you really start to paint a complicated picture, right? Different actors, different countries, different causalities.
But also pharmacists, right? So, and you are a pharmacist, you were trained as a pharmacist, so
that's correct, yes.
Is it something, for example, have you ever experienced a medicine shortage in firsthand?
Yes, I did myself. So when I finished my pharmacy degree in Portugal, I did my training in a community pharmacy. So yes, I myself experienced the fact that patients come to the pharmacy and they might not go away with the medicine they need. So and of course that creates quite a lot of anxiety in patients, which is quite understandable.
And this is actually what I wanted to talk about next. So going back to that moment where you go to a pharmacy, maybe you need to pick up a prescription, but it's not there, or maybe it's not available at that very moment. That creates an anxiety. It creates an emotional response, which is, I think, understandable and completely justified. But it can also lead to then behaviors that do not help, let's say, in solving the situation. So panic buying, for example.
That is correct. And it is true that we understand that there is a normal reaction to a particular situation. But I think what is important is to understand that in a case where there is a shortage, and in particular a critical shortage of a particular medicine, the fact that patients are hoarding medicine is going to create an even worse situation. So a bad situation becomes
hoarding,
even worse.
I mean, I guess it's within the patient's interest to be, especially if, for example, we're taking a chronic medication or something like this, to be prepared in terms of the availability of
Where
medicines.
Do you draw the line?
Where do you draw the line? Exactly.
Yes, so I think if you're a patient with a chronic disease, you'll have, let's say, 1 month, 2 months for your medicine, but you might be tempted to perhaps ask your doctor to prescribe you 6 months of your medicine, and in this situation, then of course that will have an impact. If we have already a supply tension, so we have already a critical shortage, we have already limited supplies from companies. If every single patient will be provided with an increased amount of packs of their medicine, then there will be less medicine available.
Yeah. And I think we often talk about patients, but it's not only the patients. It's, first of all, not the patient's responsibility, but also it's not only patients that are looking at stockpiling and hoarding, right? It's also an issue in other parts of the
supply chain. That is correct, and there will be situations, or have been situations, where we've seen that other stakeholders in the supply chain have stockpiled medicines, and we try to pass the message and alert, as I mentioned, all stakeholders in the supply chain to avoid stockpiling, because in a critical situation, a critical shortage, a bad situation becomes much worse if there is hoarding.
Can we talk quickly about, recently we issued a campaign that's called It Takes a Team, and it's about how, basically, what type of coordination and the actors that are actually working mostly behind the scenes and to prevent or to manage, to mitigate medicine shortages? Maybe Giulia, I'll start with you.
Yeah, so the campaign was actually a joint campaign between EMA and some of these actors, so the community pharmacists, hospital pharmacists, general practitioners, family doctors, specialist doctors. And the idea here was really to show that behind fighting shortages is a joint effort that definitely authorities, regulators have a role, but that very often there is a face to the shortage, and that face is the face of the GP that you go to, the pharmacist that you buy your pharmacy from, and that these people can do a lot in these situations. They can direct you to another pharmacy that might have a medicine that you're looking for. They can find alternative prescriptions. It doesn't mean that because there is a shortage, as we said before, a patient will go without a medicine.
Yeah, and there are also cases, because I was reading recently a report by the European Association of Hospital Pharmacists, and they reported that probably 95% of their members actually are faced with shortages almost on a daily basis, which doesn't mean necessarily that there will still be a medicine to treat the patient, but then maybe requires coordination, maybe requires changing a protocol, maybe requires discussing for alternative ways of treating the patient. So there is a lot of work that I think most people are not aware about.
That's absolutely true. So there's a lot of work in the background trying to prevent the shortage in the first place. So that's when we are made aware, and this is why it's important that we receive a notification of a potential shortage as early as possible, so that we have as much time to deal with it and find a way to, as much as possible, to prevent, so that the patient does not need to be switched to a different medicine. So that is our, of course, that's the first thing we try to do. But when that is not possible, then we have to look into mitigating measures. And there is a lot of work that is behind what is done by healthcare professionals, so as you mentioned, hospital pharmacists, community pharmacists, but also all the other stakeholders in the supply chain, wholesalers, and of course, very importantly, regulators. So at national level, in the national competent authorities, on their daily work, trying to find solutions for patients. And as I said, at European level, for the most critical shortages, here at EMA, we reach out to, when there is a critical shortage, we reach out to alternative MAHs, so alternative manufacturers.
Can we make it concrete? And Monica, because we know this, but I think it's very important for people to realize. So, for example, I think there was a case a few years ago with antibiotics where we actually, you could talk about some of the measures that we
put in place at the time. And I think that is something that most people will be aware, because I think it was soon after the COVID pandemic, and perhaps it was the first time where we had actually most countries in the European Union impacted by a single shortage, because in most cases we have maybe 5-6 countries that are impacted by a shortage, but this was a situation where this was happening throughout.
The shortage of antibiotics.
Yes, that's correct.
Yeah, for respiratory.
So once we were made aware of the shortages of antibiotics, so what we did was we identified what were the suppliers, so what were the companies that were supplying the European market with these antibiotics, and we reached out to all of them to see whether they had any safety stocks that could be used to supply the European market and to try to resolve the situation for most patients and in the European Union. So what we've seen at that point in time was, because of the lead time for the manufacture of the antibiotics, although we asked them to increase the production of antibiotics, increase production capacity, because the lead time, so is the time that takes to actually manufacture the product, was 6 months, and these antibiotics were used during the autumn-winter period. It was just too late.
You needed to find antibiotics that had already been made.
Exactly. But fortunately, we were able to identify a number of companies in the European Union that had these additional safety stocks, and they were able to supply a number of markets within the European Union. We've also reached out to other companies outside the EU, and we were, as I said, we were able to secure stocks. What is important to know is there was a very difficult situation because the shortage of antibiotics were experienced within the European Union, but also in other parts of the world. So, for instance, US and Canada, they too experience a shortage of antibiotics.
So everybody was after the same thing.
Yeah.
Exactly, exactly. So it made it much more difficult because of the fact that we were all experienced. So it was not a situation where our colleagues in the US were able to help us and put aside supplies for the European market or Canada, for instance. So we really had to look hard to secure additional supplies for the European market. But I think there was really important that we soon after the winter of 22-23, what we did is we prepared immediately for the winter of 23-24. So we put a number of measures in place. So we liaised with the manufacturers of a key subset of antibiotics used for respiratory infections during the winter. And what we did is we asked them for their supply projections for the upcoming autumn-winter 23-24. And on the other hand, we looked at what would be the demand, expected demand for antibiotics during the same period, and we matched the supply and demand to see whether there were any shortfalls.
And this is something you keep doing, right? I mean, this is something...
That's correct. So since the autumn-winter of 22-23, we every year we prepare earlier on. We reach out to the same set of pharmaceutical companies. We ask them for their supply projections. We also ask them to give us advance warning of any potential supply issues. So we ask them, please, if you see that you're going to have any difficulties, please let us know earlier on.
So this is actually preparedness work in a way, right?
Absolutely.
Exactly.
This is preparedness
as we prepare
work.
for public health threats, we also need to prepare for...
Exactly, because when it comes to shortages, we need to move from a reactive approach to a proactive approach, and that's what we're doing in many different fronts. So this is preparedness activities to really prevent shortages, being more proactive. So not only for the winter and looking at the supply of antibiotics, but we also look at events. We were talking about Hurricane Helene. So if such event happens, immediately we look into what are the potential impacts for the supply of medicines. We see now the current geopolitical situation. So if there are any new events happening, we immediately look at what is the potential impact
and there will
to the
always
supply.
be new events happening.
And we are always very busy, yes, exactly for that very reason.
Change, and I mean things.
Exactly. So when we need to do this, in fact, we have one group of experts that meets on a regular basis to look into these events and to see what are the measures that we need to put in place. So who do we need to reach out? What work needs to be done in terms of preparedness?
And when you talk about raising early warnings, for example, who are your ears on the ground, and kind of who are the people who raise?
Who gives you the information?
So, yeah.
again, all the stakeholders in the supply chain. So first and foremost, we work with the member states. So our first point of call will be our counterparts in the national competent authorities, but very often we reach out to pharmaceutical industry through the industry associations, and we ask them for any early warnings of potential disruptions. But we also reach out to healthcare professionals, so hospital pharmacists, community pharmacists. We reach out to all the stakeholders in the supply chain to get these early signals so that we can prepare with as much time as possible in advance to be able to prevent. Now, we were talking about moving from this reactive approach, so when we are faced with a critical shortage, to actually preventing shortages. And one element is what we discussed now with the preparedness activities, and the example of the antibiotics is, I think, a very good example there. But in addition to that, we are now looking at prevention of shortages for critical medicines. And critical medicines, you ask me, what are critical medicines? So are those medicines that are most essential for healthcare systems within the European Union, and for which we need to ensure...
number of
yes,
quite a few,
defined number of
yes,
medicines.
indeed, yes. We have what we call the Union list of critical medicines, currently as 278 active substances. Is going to increase a little bit, and we're just about to publish a new version of the list following an annual update of 2025. So these are the medicines that we as a network with the member states believe that are the most critical medicines for the running of the healthcare systems, and we need to ensure supply at all times. So in order to prevent shortages, what we need to do is we need to look at the supply chain of these medicines and identify potential vulnerabilities in the supply chain. So once we identify these vulnerabilities in the supply chain, then we can see what are the measures, regulatory and from an industrial policy perspective, measures we need to put in place to address those vulnerabilities. Because if we'll address those vulnerabilities, then the likelihood that we have shortages is much smaller. Yeah.
So I imagine this is quite a lot of work. I mean, I know it for a fact, but I have to say, now that you explain it, indeed, that is even more clear to me. I wanted to ask you quickly about the European Shortages Monitoring Platform, which is another tool, let's say, that you have added to the already existing tools to do this, I think, vulnerability assessment work, if you want to call it like that.
Yeah, so we are actually, at this point in time, adding further functionalities to the platform in order to be able to do this work. And why do we need a platform? Why do we need the European Shortage Monitoring Platform? Because we need to have a digital way to collect information, but not only to collect information from different stakeholders, but also to actually process that information, analyze that information very quickly, so then we know exactly what we need to do, but really fast. So one example is the matching of the supply and demand data for the antibiotics we
Sounds
did
very complicated.
in 2023. I know. So, but it's not...
It's a digital tool now for them.
It's not complicated. So imagine you need to know, as I mentioned, how much do you need in terms of demand? So what do we need for patients for a period of time of a key set of antibiotics?
This, I guess, it's an historical
it could be based on historical consumption, exactly. And on the other hand, you need to see what is pharmaceutical industry able to supply the market for the same period. And you need to match the two, because in principle they should match, because if they don't match, and if we have a greater demand and supply, we have a problem. Now, the work we did in early 2023 in preparation for the autumn-winter 23-24, that work was done manually. So we had to collect the information, collect all the data via email, and we had to do all the work manually. So what can we do today with the SMP? Well, this is all automated. So not only the burden to the actors, to the pharmaceutical industry, and also to the national competent authorities is much reduced, but it is also for us when we collect this information and we need to process, we need to analyze this information. If this can be automated through this monitoring platform, then we're going to do the work much faster, so we can actually see what are the measures that need to be put in place fairly quickly.
Mm-hmm. So get the information, or to do the analysis faster and then act faster. That's the idea. Actually, I want to ask you, Giulia, it still sounds a bit complicated, I have to say, Monica, although you explained it very well. But how is it to communicate, also to think about a campaign that can actually illustrate all this complexity, all these moving parts outside of the view of the public?
Complicated, surprise, surprise. It's complicated, I think, first of all, because you're always trying to strike a balance between not over-sensationalizing an issue, which it does create a lot of anxiety and hence is an interesting issue to talk about. But also respecting, first of all, and listening to the needs of patients who, really, some patients cannot survive without their medicine. So it's not optional whether or not they go without their medicines. And this is a balancing act, and then also it's a balancing act because you talk about shortages as an issue as a whole. Then you have a specific shortage that pops up, and all of a sudden that becomes an issue. So it's a balancing act, like everything you do as well, I think.
Maybe that's how we would call the episode, a balancing act. I have another question that I wanted to ask actually to both of you. I mean, it's like historically we were not involved in. I mean, we were involved, but in a more lateral way in managing shortages of medicines. But I think since COVID, now we're in the spotlight and we're at the forefront of coordinating, at least for the medicines and especially for.
Yes, indeed, and I think it was perhaps during COVID that it came to light that it was so much more important and much more helpful to have all member states working together rather than the individual countries working in isolation to address medicine shortages. So I think there was one big learning from the COVID pandemic. And then fairly quickly the European Commission put forward the legislation that foresees that now EMA has an extended mandate when it comes to medicine shortages. And this is going to be now further extended with the new pharma legislation and even further with the proposed Critical Medicines Act.
And yeah, in a way, I think COVID kind of was the first time that a lot of us thought about shortages in general. I mean, obviously we always talk about toilet paper, but toilet paper is a big example. Before that, I don't think there was the awareness that things like this happen all the time to many people, and it's there's a lot of work behind it to actually make it better. And what I was wondering was. How important is solidarity amongst member states in this?
It's of course it's key, and I think during the COVID pandemic, it was very important that member states helped each other with when it comes to sharing medicines. But we have now recently actually set up a process which is called the Voluntary Solidarity Mechanism. It is to be used as a last resort, and unfortunately we are, of course, nowadays not in a COVID pandemic situation, but there are situations that become very critical. And in those situations when a member state realizes that they will perhaps be in a stock-out situation. So this is where there will be no medicine available for patients in their country. What they can do is they can reach out to other member states and ask for support for a period of time. So that they do not actually, that the patients that actually do not be without the medicine. So it's a last resort and is only to cover a period of time. So if there is a critical shortage and the member state sees that, well, I will be without a particular medicine, maybe in a month's time, now I'm going to reach out to other countries and ask for help. And so far we've had 13 cases where a member state has asked for help. In all these 13 cases, they were successful.
In the last 2 years, 3 years?
Yeah, so we launched the Voluntary Solidarity Mechanism in October 23. I think our first case was only in March of 24, but up till now we've had 13 cases, and as I said, they were in all cases successful, which shows that there is really solidarity between countries, which is very important.
It sounds like something that, I mean, really resonates, with the values of the EU, the concept of the EU, right? That there needs to be solidarity also between member states to solve issues and to give. Yeah. I think we can start wrapping up the episode, but I wanted to ask you, a more general question, maybe philosophical. So we know that shortages, in the end, we cannot solve this issue completely, right? Because as we said, it is, in a way, a consequence of the world that we live in. But we can say, based on what we were discussing today, that we are much better prepared and much better equipped than we were only, 5 years ago, 4 years ago.
Absolutely, absolutely. So I think there are two elements. I think we are better prepared because we have a legislation, and that's important because it gives us a mandate to actually work in the area of shortages, but also gives obligations to stakeholders to provide us information, because without information we cannot act. We need to act based on the information that we receive. So the legislation is very important for that reason. So we are better prepared. We established structures, processes, and the platform to be able to actually collect information and act upon as needed. But on the other hand, I think we also need to understand that from a geopolitical situation, we've been faced with challenges more and more. So after the COVID pandemic, we were faced with other challenges. And so it's very difficult to also improve a situation in the face of so many
uncertainties.
Uncertainties and challenges from a geopolitical situation. So I can refer to the war in Ukraine and the energy crisis that unfolded after that. But we've seen that there are a number of difficulties that we faced with that have an implication when it comes to the supply of medicines. But the fact that we have now we have the systems, the processes, and we have a way to really improve the situation through, for instance, looking at vulnerabilities in the supply chain of medicines, putting in place regulatory measures, but also industrial policy measures. That is really going to bring hopefully results. But in the long term, I think that is another important element. So those measures will take time to actually be effective, because if we have to build manufacturing sites within the European Union,
it's not something that you can do
overnight. So this will take time. So I think that we have to be mindful that it will take time for some of these measures.
It will take time, but there is the political and the kind of European level interest in going in that direction.
That's correct. And also I think the element of solidarity is very important. So we all then are assured that in a very difficult situation, member states can help each other. So I think that is also very important. And the fact that not only at member state level, there is really the willingness to work together, but with all the stakeholders in the supply chain.
I think we are going to wrap up, but first I need to ask you the question, which
I'm so curious.
Yes.
which is, we always ask our guests if they have, recommendation for something they read or something they've watched, a show, something that can be related to the topic or not. But if it's related, it's better.
Okay, so I think what comes to my mind related to the topic is a Netflix series that I've watched not that long ago called Hostage.
Ah, yes.
So if you have a chance,
I haven't watched it, but
yes,
it's going to be on my list.
Yes, it's interesting. But I just want to say to whoever has seen this series, so the voluntary solidarity mechanism is really voluntary, and member states help each other, not like in the series where there was a quid pro quo. So when the UK needed medicines, France asked for something in return.
Yes, because there is a shortage situation, right?
Yes, there is a critical shortage situation.
No spoilers. I think we'll let
Yes, I say no more.
Judge from themselves. Okay, I have to wrap this up. Thanks a lot for participating.
Pleasure.
I hope you liked this episode. Please, if you did, share it with a friend. Subscribe to our YouTube channel, to our Spotify, or to our Apple Podcasts. Also check out the link for the campaign It Takes a Team. We will post it in the description of the episode. Thanks again for watching or listening, and we will see you next time.